That's being said, we'll start off. It's 4:05 and we have quite some substantial representation. So maybe I think we can start while we wait for others to join. So my name is Ezine. We'll start with introductions. A public health officer at the RCC of Africa CDC. Andres, can you introduce yourself? Oh, he dropped off. Ario Bakare, can you introduce yourself? He can't hear us. Okay.
Yeah, can you hear me?
Yes, yes, I can hear you.
Yeah, my name is Wahid Ario Bakari, Southern Africa RCC, Africa CDC.
Thank you very much, Chika.
Hi, good afternoon all. My name is Chika, Southern RCC, epidemiologist.
Thank you. Dr. Francis Hadunka. Could you introduce yourself and your country? He dropped off. Zain Kanbani. Okay. Could you introduce yourself, please, and your country?
Yeah, I'm Zinkambani Kambame from Malawi, working for Ministry of Health, Public Health Institute of Malawi.
Okay, and also which units do you work in?
Public Health Institute of Malawi.
Okay. There is so many people are popping. Salfi. Oh, okay. There's Howard. Okay, Howard, Zimbabwe. Could you introduce yourself and tell us the unit you work with?
Thank you, Ezine. My name is Howard Nika, Africa CDC responder, volunteer, working with the Department of Epidemiology and Disease Control for the COVID response. Thank you.
Thank you very much, Howard. Luite Mutale. Could you introduce yourself, please? Luito, we can't hear you. Okay, I think Luito is having some challenge.
Me now?
Yeah, yes, we can hear you now.
Okay, this is Luito Mtale from Zambia.
Thank you very much. Nevashan Govenda, it's been such a long time, South Africa. Good to have you back. So could you introduce yourself, Nevashan, please?
I'm Nevashan Govender. I'm the Emergency Operations Center Manager at the National Institute for Communicable Diseases. And it's been a long time because it's been really busy.
Yeah, thank you. Glad to have South Africa back on board. Okay. Next, we have Paul Zulu, Zambia as an MPHI.
Paul Zulu, Zambia, infectious diseases specialist.
Great. And then we have Dr. Simoaba Devi.
Hi, my name is Simoaba Devi. I'm a public health specialist from Zambia National Public Health Institute under Surveillance and Disease Intelligence Cluster, as well as the focal point person for event-based surveillance. Thank you so much.
Thank you so much, Dr. Simoaba. There is Safai, I'm so sorry if this is incorrect. Safai Andriamand, oh my goodness, I'm sorry. But
yes, good morning, it's very long name. I'm Swafi Andriamandim from Madagascar, from the lab of diagnosis at the Institut Pasteur of Madagascar.
Okay, great. Okay, Madagascar joined us today, even though, well, Madagascar, thank you very much for joining us. Watipaso Kasambara. Could you introduce yourself? Okay, so Kufa. All right, so we will continue and get back to the introduction much later. So for agenda today, it's going to be a bit of recap of what's gone on. Let me share my screen. Okay, so where is my screen? Why is this not sharing? Okay, I'm having some challenges sharing screen. But for today's agenda, we have introductions. There are so many things open on my screen. I think that's the problem. Okay. Okay, great. So for today's, we're going to have done introduction. We'll have a look at the EPI updates. And then we want to give you an update of all the activities we have in the region and how you can get support from Africa CDC if these activities aren't happening in your country. And then we'll move on to an update on the COVID-19 status in member states. You can give us a brief update on the thematic areas of IPC, case management, surveillance, lab. So the best practices, any challenges you have that we can help our team. And then finally, we want to do a brief EBS assessment, which my colleague Chika will take over. So just moving on to the EPI updates, I'll hand over to Chika. Chika, I'll share the screen for you. Let me know if you can all see the screen for you too. So Chika, please, the EPI updates.
Are you able to put it in slideshow?
Hello?
Thank you, Ezine.
Yes. Can you see my screen?
Yes, but
Yes,
I think you need to, it should be on the full.
I've tried. Why is it not showing? Oh my goodness. Okay, so.
It is showing. It is showing.
Okay. What's the challenge?
You have to click on the slide view.
Which I have. It's showing me that it's on full screen here. Oh, wow.
No, it's.
Okay.
Beneath the slide.
I've done
before
that.
The Zoom part of it.
Yeah, I've done that and it's still not showing. Oh my. Is it possible?
Maybe it is network and it is not giving the full screen.
Yeah, because I've done that. It's not showing. I don't know why. Mine is showing in full screen. Is it there now?
Yes, it's okay now.
Okay, now it is better.
I guess that was
better now.
So yeah, Chika, take it away. Just let me know when to move to the next slide.
Okay. All right, thank you, Ezine, and good day all. I would like to take you through the epidemiological situation as of 16th September 2020. Okay, thank you, Ezine. So here is the global epidemiological situation of COVID-19 update as of 9 a.m. Central European Time, 12:47, I mean to say, 12:47 European Time, 15 September. And then on the left shows the world map of affected countries, and the chart on the right shows you the distribution of new cases this week by 6 geographic region, and each color represents the regions on the legend. So the orange color region, PAHO, is reporting majority of the cases, and Africa is on the red bar on the chart, which accounts for 5% of the global cases. So majority of these cases are being reported from the Americas and European region. Overall, beneath the world map, the figures shows you the distribution of COVID-19 cumulative cases and deaths. And globally, the world has recorded over 29 million confirmed cases of COVID-19, of which over 920,000 have died, resulting in a CFR of 3.2% from over 217 countries and territories affected by the pandemic. This is the next slide, isn't it?
Okay, now there is another problem. What is happening with the network today?
Or should I share my screen?
Yeah, because I think I'm having.
Enable me to share.
Is it working now? Yeah, it's working now. Sorry, this is the next slide.
Okay, so this slide illustrates the epidemiological situation of COVID-19 in Africa as of this day, 16th September, 9 a.m. East African time. And this epic curve on the slide showing the percentage increase by regions. The red lines on the red line on the charts represents the 7 days moving average that indicates a continuous reported cases in 55 member states. So the Africa figures shows over 1.3 million cases, 33,000 deaths, resulting in a CFR of 2.4% and over 1.1 million recoveries. 82% people have recovered from COVID-19 across the continent. Please, the next slide. Okay, so this table shows the new cases, deaths, and recoveries, and the cumulative of the three important variables, and over 5,000 new cases, and 246 new deaths, and over 18,000 recoveries were reported in the last 24 hours. So over half of this were reported from the northern and southern region. The northern region is still reporting the highest CFR of 3.5%, followed by the southern region. Please, the next slide. Okay, so this is the map of Africa showing categories of member states reporting COVID-19 cases. On the left side of the slide shows how it has been categorized into 5 different groups. So 27 countries are reporting less than 5,000 cases, 11 countries over 10,000 to 50,000, or 12, I mean to say 12 countries. Then 11 from 5,000 to 10,000, 4 countries, 50,000 to 500,000 cases, and 1 country, and the only country that is reporting above 500 is South Africa. Please, the next slide. Isn't it? Please, the next slide. Okay. So this is the map of Africa showing cumulative COVID-19 incidents by African Union member states. Here, it is also categorized, showing 1 country with no data reported on the incidents, and the 6 countries are reporting less than 10 cases per 100,000 population, and in 31 countries between 10 to 100 cases, and in 14 countries. You've moved to the next slide. Okay, so lastly, with regards testing, this graph illustrates the cumulative testing in all EU member states. Over 13.5 billion tests have been conducted across the continent, 9.9 tests per reported cases, and the overall positivity rate is still 10%. So the percentage increase is 6%. Thank you for your attention and your time. Over to you, Ezine.
Okay, thank you so much, Chika, for that. If there are any questions, you can drop in the chat. While I just go through the new people who have joined us, for them to just quickly introduce themselves. Let's know where everyone is from. We have Tokmo Maruta. Could you introduce yourself, Tokmo Maruta, and where you're from?
Thank you very much, Esne. This is Tokmo Maruta. Recently joined the Africa CDC and based in the RCC in Lusaka. Thank you.
Thank you very much, sir. There is Olivia Nakwafila. Where you're coming from, which country and what you do, please?
Yes, I'm not sure if you can hear me, but I'm Olivia Nakwafila. I'm from Namibia, an epidemiologist in Namibia.
Thank you so much, Olivia, for joining us.
Thank you.
We can hear you. There is Dr. Owen Musopole. Could you introduce yourself?
Yes, Chair. I'm Owen Musopole, Quality Management Officer from Malawi.
Okay.
Thank you.
Great. And there is Dr. Francis Handunka. Could you introduce yourself?
Right. Thank you very much. I'm Dr. Francis Handunka. I work in the southern province of Zambia as an epidemiologist. Thank you.
Thanks a lot. Andrew Likaka.
Yeah, thank you. Andrew Likaka, working with the Ministry of Health in Malawi as the Director of Quality and Digital Health. Thank you.
We have quite a strong representation from Malawi today. Thank you so much. There is a Hawaii P Smart 2019. Could you rename yourself to your name and the country, please, and also introduce yourself? Hawaii.
Good afternoon.
Okay.
Good afternoon.
Good afternoon, I can hear you.
Yes, I'm Catherine from South Africa. I'm attached to the National Department of Health and Quality Directorate.
Thank you so much, Catherine, for
Thank
joining
you.
us today. I really appreciate it. South Africa is coming back strong. There is Kufa. Could you introduce yourself, Kufa? No, nothing from there. Raymond Hamonga, could you introduce yourself?
Good afternoon, everyone. My name is Raymond Hamonga. I'm with the Zambia National Public Health Institute as an epidemiologist. Thank you.
Thank you so much, Dr. Ray. So we have quite some thank you all for joining today. We have representation from Malawi, from Zambia, from Zimbabwe, from South Africa, from Namibia, and Madagascar. So that's quite impressive, given that we've not had this session in over a month. Thank you so much. And going forward, we are going to stick to our every 2 weeks. And so moving to the second part of today is updates on all the activities that Africa CDC has in the region and how your country can benefit from these activities. So I'm going to run through all the activities that Africa CDC has currently ongoing in the Southern African region and the countries where these are ongoing and the status of these activities in the country stated, and then round up with how, if your country isn't among those engaging in these activities or have reached out to, how we can engage with you. So first is the Africa CDC. If you have any question while I'm presenting, can you just drop in the chat I'll come back and go through them. First is the Africa CDC field epidemiologists. So we have volunteers in 4 countries in the region, about 10 in each country except in Namibia where the number is less. So we have Zambia, Zimbabwe, Malawi, and Namibia where we have volunteers ongoing. And how these people got volunteers is that they requested Africa CDC for volunteers to support the COVID response for specifically field epidemiologists. And that's how we got engaged with these countries and have these volunteers there. So secondly, there's a support for seroprevalence studies that is ongoing while we plan, or we've engaged 5 countries in the region. One is Zimbabwe and another Zambia. Then the remaining 3 that have the question mark, Mozambique, Botswana, and Malawi, are countries we have. For Zambia and Zimbabwe, we have reached quite an advanced stage in this support, and I think it's just what is left is to roll out. But we've engaged Mozambique, Botswana, and Malawi. I'm glad Malawi is quite well represented today, and we are still discussing with these countries to see how we can move forward. Then third is the support for community healthcare workers, which are quite essential at this stage of the COVID-19 outbreak, a pandemic, where we need a lot of foot soldiers. There's extensive community transmission now, so we need community healthcare workers to help with the groundwork. So we have deployed in Malawi and Zimbabwe, and we've reached an advanced stage with Eswatini to deploy. We've also on the discussion phase with Zambia and South Africa to see that these are supported in the countries. In all these countries, we have partners that we had identified. For most of the countries in this region is AMREF, and for some it's Affinet that we're working with to help with these in the country, support these in the countries. Then next is IPC in-country trainings. So for our region, we have Zimbabwe, Zambia, South Africa. For Zimbabwe, we've managed to conduct 2 of these trainings. For Zambia, we've conducted 1. In South Africa, we have 2 scheduled for the ending of this month, and a 3rd one probably next month. At Malawi, we have just started discussion with Malawi. Then there is the biosecurity, biosafety training that we have. We proposed to have in Zambia, Zimbabwe, and Eswatini. These have all reached very advanced stages, and I think the next stage is to roll out. And then we have support for mortality surveillance. We have moved on very far ahead with South Africa, but Zambia, we are still at the initial stage of deciding how best to go with this in the region. And then finally, we have the COVID-19 response supplies that we have sent to countries. For those in the lab that we have been working with, we have sent 3 waves of independent lab supplies to all countries in the region. And then we are just in the middle of sending out the 4th wave of supplies, both IPC, case management, lab supplies, from Africa CDC in collaboration with partners. So the first one is just lab, and then the other one is other supplies in addition to the lab supplies, and these are done in collaboration with our partners. So this is just to give us an overview of how much we've done in the region and how much your country stands to benefit if you reach out to us and if you avail yourself of the opportunities. So the last slide here is just a way of just really putting out there that if you need support from Africa CDC, there are many ways to go about this. One is there are already countries, like the 4 countries where we have volunteers, the field epidemiologists in. It's easy to reach out to us because we already have established a mechanism of communication, and we support the work that our volunteers are doing on ground by means of trainings, capacity building sessions, so that those 4 countries, if there is need for anything, you know the means of communications you have to request for that to support the field workers. And then the official form of making a request to Africa CDC is to write a note verbal to the African Union Commission through the embassy in Addis. So when you do this, send us at the RCC an advance copy, a copy so that we can advance this to the Director of Africa CDC.
Oh, about change station is take capture because.
Okay, sorry about that. So
Hello? Can't hear you, isn't it?
oh my goodness, sorry about that. I didn't know you stopped hearing me. So I'm saying for you to provide requests to all the documents or the note verbals, the request to make to you, those are necessary for us to be able to plan ahead for the support we're giving the country. So if you I don't know, quite a number of us here recognize your names. I have sent emails to you before on sharing note verbals or requests, whether in the lab, surveillance, case management. That's another way to get support to come quickly to your country, because when you respond, we start with the people who have responded, because at least we can articulate this is what they need, or we at least have a contact person to say we can start talking with this person about that. So in summary, the essence of all this is to tell you that there's quite a lot that Africa CDC is doing across the continent, not just in our region, it's across the continent. And a lot of countries are benefiting because they are availing themselves, and they are, at least you need to show your foot, and then we can work with you to see if we can help you or not, but we need to see that commitment from countries. So either of these, if you have any questions on how we can help, like I said, I'll drop my email and the official RCC email in the chat function, and you can write to us. If we already have someone that we are in communication with in your country, we'll link you up with that person. We have country focal points, some of which are on this call. So we will link you up with the focal person in your country, and we'll see how best we can go about it. So that's all from me. Thank you very much. If you have any questions, I'll just give a minute or two for you to ask your questions. No questions? Everyone is so quiet, not even a clarification. Yeah, Howard, your hand is up. You can ask your question.
Thanks, Ezine. Thank you for that presentation. So I just wanted to get clarity, or maybe just an explanation on the support for mortality surveillance in the countries that you mentioned. what exactly are the activities that are going on? What nature of support is being given? In case maybe here in Zimbabwe, we might require the same. Thanks.
Okay, Howard, there is a concept note that Africa CDC has developed on mortality surveillance on COVID, as well as also there we have like a mortality surveillance is one area that Africa CDC has been working on quite some time before even the COVID-19 outbreak. But now we want to see how we can use through this, strengthen that in countries. So Howard, if you drop your email, I can share the concept notes that we have from Africa CDC with you and see if that's something that Zimbabwe is interested in, and we can see how we can take that forward. We have a specific unit that deals with mortality surveillance. If that's okay, drop your email and I'll send that to you after the session today. There is another.
That'll be great. Thanks.
There's another hub. Oh my goodness, I'm sorry. Your hand is up, Zinkambani. Please ask your question.
Oh, I can see now you're struggling to pronounce my name. Yeah, but my question is similar to the previous one. Just want some explanation on the kind of support you are providing for self-prevalence surveys. That what kind of support explicitly are you providing? And also the time you are presenting, no, someone I think was presenting. Yeah, so we can see that the number of tests are actually increasing, but I know some countries like Malawi is also an example. We are facing the challenges in terms of testing. It's like the number of tests has gone down. Of course, could be due to the change in guidelines, but also there's some challenges are due to inadequate reagents. So I don't know, is that kind of support that you can provide? Over.
Okay, so you have two questions. One is on seroprevalence, which I'm going to defer to Dr. Tokmo Maruta. That is his area. He will answer that. And the second one is on the tests. I know we generally, countries have had to revise their testing strategies, and also countries repeatedly have these almost stockouts of tests, test kits. But Malawi, as case in point, we have just sent, like I mentioned, we had just sent the first wave of supplies, and Malawi is one of the countries that I think Malawi, we got feedback. If Watipaso is online, she can confirm that they received supplies. Yes, maybe you can allude to that. You can confirm that.
Yes, I wanted to respond to that we have received reagents and supplies from Africa CDC. They just got in the lab this morning, and the tests which we have received, they are for about 10,000 tests. So that's another supply which we have received from the previous ones, which we have also received from Africa CDC. Secondly, I also wanted to add in my voice to the prevalence survey that we are almost in the final stages of submission. I think Tokmo will talk the same way. We've been going back and forth to harmonize the seroprevalence survey to our own. So we are almost finalizing it so that we can submit today, possibly today or tomorrow. So we, though they put a comma there, but we are in the final stages of submission of the seroprevalence survey. Thank you so much.
Thank you. Dr. Maruta, do you want to contribute to that?
Thank you very much, Esne, and thank you, Watipaso, for that update in terms of the sero survey. So Africa CDC is supporting countries in the region to implement COVID-19 sero survey. And our main areas of support include: one, providing technical assistance, in the development of the protocol, implementation of the zero survey, as well as the reporting at the end. So once a country is engaged, Africa CDC puts together a team of experts that specifically work with that team throughout the process. Secondly, we provide support with the rapid test kits. These are, since the zero survey, these are antibody-based test kits. We are in the process of procuring this, and as they come and as the countries get ready, we then provide them with the testing kits. Thirdly, we support with the logistics in the implementation of the survey. This includes things like the trainings that you may want to do, supporting field staff in terms of the resources they need to be in the field, for sample collection, if your protocol involves sample collection. So all those are logistical support, transport, and so forth. So these are the three key areas that we support in seroprevalence survey. Over.
Thank you very much, Dr. Maruta. Ario Bakare, your hand has been up. You can ask your question. Dr. Bakare?
Sorry, it's not a question. I just want to add to what you have said. Good afternoon, everyone. In addition to what Ezine has highlighted earlier, so in the area of
Dr. Bakare, we are losing you.
Prevention and Control, IPC. Hello?
Yes?
Can you hear me now?
Yes.
Yeah. Yeah, so I'm just trying to earlier and control IPC, as she said earlier. So we are doing step-down training to provide a pool of IPC trainers, of healthcare workers in the member state, so that they can train other health workers in their various facilities and settings. So apart from that, we are aware that many countries are opening schools now, and it's a concern to us. And we have support in the area of IPC that we want to provide. So we have sent emails to all country IPC focal points to start working with education ministries and departments and the IPC focal points at the provinces and the district level, so that they can identify IPC focal points for all their schools, from primary to secondary to tertiary, so that Africa CDC can support their countries in the area of training. So we want to train these people. We want to train them as the school continues to open, so that they know what to do, they know what to put in place to minimize the spread of COVID-19 in our schools. So that is what I want to add. I know some IPC focal points on this call, they have received our email concerning that. And I just want to plead with them to take it serious and work on it. So they need to start working with education ministries and all departments. I don't know what they call it in their country, and also those at the province level and district level. They need to work together to identify these people. So once they have this list, they have to send it to us, and we strategize from there. Over.
Okay, thank you very much, Dr. Bakari. So that's part of the new initiative that was launched by Africa CDC, which is we're in a different phase of another phase of the outbreak. And this initiative is saving lives, economies, and livelihoods. Economies, countries are opening up, schools are opening up, airlines are opening up. So we need to look at sustainability and how we can open up economies safely, or go back to work safely, go back to school safely. So that's where we're moving towards now. Is there any other question by anyone? I don't see any other question. If there are no other questions, I think there are new people. If there's anyone new, there is a Kanjo Kaisi. If you could just tell me what country you're from. And there's Nelson Zinza as well.
Hi, my name is Muneti. I'm from Malawi.
Okay. Thank you.
Hello, this is Nelson. I'm from Malawi as well.
Wow, Malawi is everywhere today. Thank you very much, Malawi, for your engagement today. It's quite impressive. So we're just going to move on to the next part, which is you giving us feedback. We just want to know, for a while now, most of our eco sessions have been on COVID because that's the thing. Probably from next month, we will start moving on to other things. But if the countries online can just give a brief overview of the situation in your country, if there are urgent concerns, if there are challenges, if there are best things you've done differently that other countries on the call can learn from, just in a minute or two, just give us an overview for your country. We can start with our host country, Zambia, who can, I think, I saw Dr. Simwaba, Dr. Raymond, or any of the APs. You can give us an update on how the situation is in Zambia and what Zambia is doing differently to get ahead of the whole situation. Who is going to speak for Zambia? Just a few minutes. Dr. Ray? Or any of the epidemiological?
Hi, Zine.
Yes, thank you.
Is Dr. Simab on the call?
No, he dropped off. He was on the call, but he's no longer on the call. So we might have to look to you to give us just a very quick overview of what Zambia is doing differently and any challenge that you may.
Okay, so as Zambia, just like everyone else, we initially had our places and our feet all over the place, but now we've developed COVID-19 SOPs and guidelines, which are going to standardize the response from, across the whole country. In Zambia, we've utilized a community model where we are only reserving facility admission to those who are symptomatic, those who've got underlying conditions, and the very young, and those above 50 years old. Everyone else is going to be managed under the home management model. That means if you're diagnosed with COVID-19 and you're not symptomatic or got very mild symptoms, you'll be encouraged to stay at home and you'll be managed and monitored with a community healthcare worker. That's the model we've adopted, and the very fine details of how that is working are contained in the COVID-19 SOPs and guidelines. In terms of challenges, I think, like everyone else, we're still having challenges around reagents, up and maybe triple our testing numbers in terms of numbers we're testing on a daily basis. And sometimes when we have the reagents or when we have the samples, one or two other things are down and so on and so forth. But that's been our challenge. We're still not happy with our testing numbers, and we hope we can improve on that. And also, the community healthcare that we have need to receive adequate training around COVID-19, because we are writing based on the people who are trained for community health management around HIV, AIDS, tuberculosis, but we need to reorient these and develop guidelines and SOPs for them to manage COVID-19, as well as also how to see what we can supply in terms of basic PPE for these community healthcare workers who are going in the field. So in a nutshell, that's where we are at as Zambia. I submit.
Thank you very much, Zambia. Zimbabwe, can someone give a quick rundown as well? Zimbabwe.
Hello, thanks, Azin. So I'll just briefly report on behalf of Zimbabwe in terms of what we're doing in terms of COVID-19. So for Zimbabwe, I think one thing that's quite different that we're doing is in terms of decentralization of the dissemination of lab results for COVID-19. So previously, most of our samples were being sent to our central referral laboratories, and then they were managed through what we call the lab information management system, and this was also centralized. But I think in the next few weeks, we're working on decentralizing that, such that all the referring facilities will have access into that system, that they can get the results for the samples that they would have sent. So this will quicken up interventions in terms of the RRTs knowing the results and the outcomes of the samples that they sent, so that they can respond accordingly. Secondly, I think we are also quite busy in terms of occupational health and safety for health workers, integrating COVID-19 into that. So all of the facilities in terms of COVID-19 response will periodically hold occupational health and safety workshop for their health workers, so that they can get screened, tested, and also they can get more information in terms of the emerging issues for COVID-19. And then lastly, in terms of the updates, I think we are also looking at possible research areas in terms of COVID-19. So apart from the Zero survey that's being commissioned, I think one of the pillars in terms of the national response that is being looked at is the facilitation of a research agenda. And some of the topics that we are looking at is we want to document some of the home isolation practices in terms of the COVID-19 positive cases and their contacts in our urban settings. And also looking at risk factors for contraction of COVID-19 amongst health workers as well. So those are just one of the few topics that we're looking at. And then we're also working with community health workers, where we've created a system where community health workers will link up with the rapid response teams. So we've also decentralized further rapid response teams, not only at district level, but also up to the facility level. So every facility is expected to have a rapid response team where they will link up with the community health workers, which have been deployed through Africa CDC, to make sure that all the information is transmitted to the RRT for further transmission to the higher levels as well. In terms of challenges, I think it's the same in terms of testing. Where some of our decentralized laboratories have shortages of cartridges for some of our gene expert machines, so that we can facilitate sample analysis. And also in terms of our borders, there are also reports that there's continued smuggling of illegal border jumpers from neighboring countries as well, who don't pass through the formal system, where they can also receive COVID-19 testing. So that's another challenge that we still have. So in a nutshell, that's what we're doing in Zimbabwe. Thank you.
Thank you so much, Zimbabwe, for that. Malawi, if you have any questions, please, you can drop for the presenters in the chat box. So can we have a brief from Malawi as well? We have such a strong presentation today.
All right, I had thought that our director, Dr. Ikaka, will come through, but let me just give an outlook. Most of the things which Zambia and Zimbabwe have mentioned earlier, basically, that is also already happening in Malawi. Malawi is also trying to normalize the situation and open up economy. So we have seen a number of schools have opened from 7 September. They're opening in a bit a stepwise approach. So that has been done in conjunction with the Presidential Task Force on COVID-19, and there is heavy monitoring of the situations within the schools which have currently opened. Something which also to note is Malawi already decentralized a testing system. So currently in the country, we have got 16 laboratories which are performing PCR, which are currently running the test. The challenge, as many countries have already said, is the reagents and supplies. So our huge demand right now is to have the reagents and supplies. As you know, is in the reagents which we have just received for TIB, the German kit, which we can only use through the other platforms of PCR, not the Abbott platforms. But many of our platforms in country airborne platforms. And because of the huge demand, we are not able to test as many more samples as possible because of the resource limit which we have currently. But we're trying on daily basis. Currently, we are testing from 500 to 600 samples in most of the 6 laboratories which we are testing currently. In terms of one thing which the country is also doing is to change the strategy from previously, as we reported, the testing strategy has changed. Many of the samples which we are testing right now, because of the resource which we have, we're testing the ones traveling, but also we're testing those ones which are symptomatic. So basically, that's the approach which the country has taken to limit, to utilize the resource which we have to those only who need them. So because of this huge demand which we have, that's why we moved in to request the cell of prevalence survey so that we can be able to use the RDTs, validate it, so that we can be able to use for community transmission, we can be able to define that extent how the communities are affected. So in terms of IPC, I think my colleague, Dr. Mosopole, is in here if he wants to add more, but I think those are the main highlights of what is happening in Malawi. Thank you, Ezine.
Thank you very much. Dr. Mosopole, you want to say something? No. Okay, so we'll move to, she had dropped a question. I'll follow up on via email. We'll move to South Africa, Nevashan and Ms. Catherine, if you can just give us an overview. I'll address your question, Nevashan, after the presentations of what's happening in South Africa. You have been very quiet on our echo sessions, and that's where everything is happening on the continent. So we'd like to hear from South Africa.
Yeah, so obviously there's a lot going on. We've had WHO in country to do an intra-action review, and we're now moving that intra-action review down from national level to provincial level. This is all in preparation and planning for resurgence. We worked on a national resurgence plan, and that is how we share with the provinces, and we receive feedback on that document. For resurgence, we have learned a number of lessons from the first phase response and adjusting as best as we can. There's a new laboratory testing strategy that incorporates the rapid tests as well. There are a number of studies that are on the go, and a number of studies that are planned, including a school transmission study. We're also taking the similar approach, such as other countries, by doing focus on high-risk groups and high-risk occupational groups as well. And we're also looking at specific clusters, such as school-going children, prisoners, healthcare workers, old age homes, as an indicator for resurgence as well. So if you're having lots of clusters of these coming up in areas where there hasn't been ongoing transmission, we'd also see that as an indicator of resurgence. Yeah, we're planning for district and provincial support from a national level. And yes, there is we're also suffering the consequences of this for consumables for testing. There's, obviously there's global competition for that, and we're trying to do our best to manage that situation. In a very quick nutshell, that's what I can input.
Okay, so just a quick one for you, Nevashan. The intra-action review, we got that information about 2 weeks ago that you had that, and it will really be amazing if you can do a presentation for the group next 2 weeks during our echo session, because I know Zambia is planning to do one, and quite a number of countries are also planning to do this. and it will help if they can learn from you how you planned it, how you did it, and just that experience sharing. Is this possible?
Yes, so I will actually include you on the request to the IMT EPI lead at the time. The IMT EPI lead is a rotational position. So the person that was the IMT EPI lead at the time was actually my divisional head. So I think that would help. So I will write to her, include you in the email for her to actually do that presentation, because she was key to this interaction review. So I think it is possible. So let's do our best to ask.
Thank you very much. That will be very, very, very well appreciated. Catherine, do you have anything to add for South Africa? Has she dropped off?
Thank you so much. And thanks, Naveshan, for the information that has already been shared, which is some of the things that I had in mind. But I think to add to what he has just indicated, because of the infection that happened on the healthcare workers, there is a stream that is working very close from the OHS, which is checking, working on the infection for healthcare workers. What could it be the reasons? Some research is being conducted there. And I think this is helping, because once they've identified the challenges, we'll then know what next to do even for future. But I think also what is coming very clear and nice from our side is that we are trying to integrate occupational health and safety together with IPC. So we're saying the teams within the provinces, districts, as well as facilities, the OHS as well as the IPC should see themselves working together. And we are also following up to make sure that there are committees that have been established for both OHS as well as IPC, and to make sure that they're being trained. So just to take IPC forward, even beyond, COVID, as well as OHS beyond COVID. I think this is what I wanted to add from what Naveshan has said. Thank you so much.
Thank you so much, Katrina. So we'll move to Namibia. Olivia, if you can just give us a brief overview. Olivia?
Okay, sorry, I'm driving as I'm listening to this. But well, in Namibia, what we are currently doing, we have developed SOPs for the people who are coming in, especially those who are coming in via the harbor. So we are testing and quarantining them as they come in. And also something that we started doing, we have decentralized the testing for COVID-19 in the different regions. So you can actually see that there's a difference in the number of the tests that have been done, for instance, compared to day to last week. Yeah, I think that is all that I can, yeah.
That's okay. Thank you very much for all that feedback. I've gone to the chat and there was a question from Naveshan, and unfortunately he has dropped off. But the question is to find out if we ever discussed analyzed a regional cross-border surveillance strategy. WHO and Africa CDC had worked together to develop some cross-border SOPs. This is building up on the one developed by SADC. And we had a webinar to discuss this, which some people here were in attendance, and I think Naveshan was also in attendance. So it was up to those people who had attended the webinar to carry it forward. And what I'll do is that, since this is an ongoing conversation, I don't think we can ever stop emphasizing the need for cross-border surveillance, especially in this time. During our next echo, I'm going to get an update from the WHO angle and also from countries how far they have gone with these documents. So just to wrap up, I think the last thing a lot of people are beginning to drop off, who've really overstretched by already 5 minutes, is the, what's it called, the EBS assessments that we wanted to do with member states, just to find out how you've been using EBS for surveillance for COVID, I'm trying to do the next page, and this is just okay. So it's just a very quick survey of whatever countries are online. Just give us 5 more minutes and we'll just wrap up with this. Chika, you can take over. Is Chika online?
Yeah, I'm online. Thank you.
Yeah, you can take
Thank
over.
you everyone for,
I will type as you're discussing.
important feedback. Yeah, so the essence of this is to, to know how EBS, just to assess EBS in your country. And we noticed that I think most countries are highly focused on COVID-19 reporting, and they have ignored other infectious or priority diseases. So we would like to assess how EBS is in country, so as to help us, help Africa CDC know how to support you in this area of surveillance, to strengthen surveillance in your country. To cut the long story short, for Angola, I don't know if we have anyone from Angola.
No, we have.
No.
We can start from Malawi.
Okay, so Malawi representative, please, could you kindly inform the House EBS implementation status? Is it very active, mildly active, or not active at all?
Mildly active.
Okay, what channels do you use?
Okay.
Both of them, hotline, SMSs. The people do call in, but the responses, that's why I'm saying it's mildly active.
Okay.
Okay.
Is it strictly on COVID or all infectious diseases?
It was on all infectious diseases, but it has been activated because of COVID.
Okay, so now do you take other calls for other diseases?
Okay.
Of course, we have for other diseases, yes, we do have. But the people were not, the public were not aware about the event-based surveillance. They have known it because of the COVID, but it has been there for all the infectious diseases.
Okay. And then what software or tools do you use? Is there any software you use at all?
Hello?
Is there any software you use at all?
Yes, there is, because we have, if Dr. Andrew Likaka was here, would have given more in-depth about
tools.
Yeah, on the tool, because we even have a program, we call it Chipatala Japa Phone, where people are supposed to call in if they have any issues so it's a separate tool with its own program and with its own implementation tool. So right now, because of that program, we have added COVID to that. So that's when it's become very active.
Okay. So we're still going to send this to you to help us, please get people to fill this detail for us.
No problem, we'll respond.
So Namibia, Olivia.
Okay, so please, lastly for Malawi, is it just on the federal level or state or local government? I mean, EBS, has it been cascaded to other parts of the state or just on the federal level? National level? For Malawi.
She's gone quiet. I'm not sure she.
Okay, I think we've.
So is Olivia still online?
Let's go to Namibia.
Olivia? Hello, Olivia. She's online, but she can't.
Sorry, I lost connection. You were saying Malawi.
Okay. Chika, you can ask.
Yes, I was saying, I said for EBS, is it just on the national level, state? Where are you guys at? Are you just on the national level, or it has been cascaded to the state and local government level?
No, I think it's on the national, because it's only the national which are controlling it, but people can call in from all areas.
Okay, thank you.
So Namibia, Olivia, she's still not saying anything. Maybe we can move to Zambia. Is there anyone that can give us any updates on EBS in Zambia? Everyone is quiet. I'm going to look for people in Zambia. There's Nelia Langa. There is Dr. Francis. There's Siange Dani. Can any of you give us any information on EBS in Zambia? Everyone is quiet. Zimbabwe.
So let's move to South Africa or Namibia.
Africa has dropped off. Zimbabwe.
Yeah, so for Zambia, I can't give a national picture. We can only talk about a regional because I'm at a regional. This is Dr. Hadunka.
Okay.
So I think the people at the national level would be in a better position to talk about the national. For the regional, yes, we can give an idea, but not for the national. Thank you. I see people from the national there.
So can the national people say something? Okay, so maybe we can move to Zimbabwe. I will still share this with people on this call to help us input. Zimbabwe, Howard, I think you're the only one.
Thanks.
Okay, there's
Yeah.
still... Yeah.
Okay, thanks, Ezina. So I would request that maybe you also send me this so that I also share with my colleagues who are in the Health Information and Surveillance Unit. I think they can provide just that much more detail than I can. But what I can just say is in terms of EBS implementation status, it's quite active, particularly for COVID-19. Yeah, so it's quite active. And then the channels, I think we set up a hotline, 2019, that we're working with. But we also have hotlines for other disease areas and other programs. So it's not only for COVID-19, but also have hotlines for other disease areas, be it HIV interventions and so forth. So EBS is not only strictly for COVID-19 in Zimbabwe. There are quite several programs that use event-based surveillance, ranging from malaria, HIV, programs such as VMMC and so forth. Yeah, so I think in terms of the software issues, I think that would need the guys from the Health Information and Surveillance. But in a summary, it's quite active in Zimbabwe, the EBS.
Okay.
Okay. Thank you very much for that feedback. So I want to quickly ask the hotline used in Zimbabwe.
Chika, you dropped off?
Zimbabwe.
Sorry,
Sorry,
Chika.
Is it for other infectious or priority diseases? Are you able to hear me now?
Yes,
Hello?
yes, I can hear you now. Go ahead, please.
Okay, so I want to, just for clarity, want to really understand, are there two different hotlines, one for COVID and one for other priority diseases for the public to reach out to the institute?
Yes. So there is one hotline that is specifically for COVID-19, 2019. And then the other disease areas, they've also got their own hotlines where the public can reach out to the health workers. But the system is such that at the end of the month, everything is then centralized and analyzed centrally.
Okay, so please, like you said, we'll share this for you to also help to add other information and other comments that we need to know about. Thank you.
That's fine, thanks.
Thank you very much. Catherine, is there anything you can say about EBS in South Africa? I don't know if there's anything you can comment, or I can send this to you. You help us to send it to the people who have the information.
I think that will be correct to send that to me. Thank you.
All right, thank you so much. Is there any other question? We're 15 minutes beyond time, but it's been a long time we talked, and I think you'll forgive us, please, for extending 15 minutes into your other business. If there isn't any question, thank you very much. We really are hoping that South Africa will be able to give us a presentation next week, but when I'm sending out the invites, I'll include if that's possible or not in the agenda. And I'll also give the updates on the cross-border surveillance initiative we have in collaboration with WHO Afro to see how that has gone and how we can also push it forward as a region. So thank you very much. If no one else has any questions, I think we'll call it a day here and we'll meet again in 2 weeks' time. Thank you very much for your time and have a lovely evening.
Thank you.
Thank you.
Thank you so much.
Thank you.